What type of blood cells are affected by multiple myeloma, a type of cancerous tumor? A. Neutrophils. B. Eosinophils, lymphocytes, macrophages, plasma cells. Well, the answer is plasma cells, the true answer. What is the main characteristic feature of Hodgkin disease? Aschoff bodies, eosinophils, Langerhans cells, red Sternberg cells, Russell bodies. The answer? Red Sternberg cells. Nodular sclerosis is a subtype of which disease characterized by the presence of collagenous bands dividing the lymphoid tissue into nodules? A. Rheumatoid arthritis. B. Hodgkin lymphoma. C. Infective endocarditis. D. ALL, acute lymphoblastic leukemia. E. None of the above. Well, the answer is Hodgkin lymphoma. B. Nodular sclerosis is characterized by the presence of collagenous bands, lacunar cells, red Sternberg cells. Emphysema is characterized by abnormal permanent enlargement of the air space found in which part of the lungs? A. Proximal to the terminobronchial. B. Distal to the terminobronchial. C. Proximal to the respiratory bronchial. D. Distal to the respiratory bronchial. E. All of the above. Well, the answer is B. Distal to the terminobronchial. What are the causes of emphysema? A. Parenchymal scarring. B. Alpha-1 antitrypsin deficiency. C. Smoking. All of the above or none of the above? Well, parenchymal scarring, alpha-1 antitrypsin deficiency, smoking, all these are the causes of emphysema. What are the characteristic histological findings in the airway of a patient with chronic bronchitis? A. Mucus gland hypertrophy. B. Goblet cell metaplasia. C. Squamous cell metaplasia. D. Non-specific inflammation. E. Bronchiolitis obliterans. Well, all these are characteristic features that we see in chronic bronchitis. What are the characteristic histological findings in the airway of a patient with bronchial asthma? A. Mucus gland hypertrophy. B. Basement membrane thickening. C. Smooth muscle hypertrophy. All of the above, none of the above. Well, all of the above are the answers. So mucus gland hypertrophy, basement membrane thickening, and the smooth muscle hypertrophy are histological findings that we see in bronchial asthma patients. Bronchiectasis may result from A. Necrotizing pneumonia. B. Chronic bronchitis. C. Severe emphysema. D. Cartagena syndrome. E. Cystic fibrosis. Well, except severe emphysema, all the others are true. Which ones of these following are acceptable characteristic of a granuloma? A. Composed of altered macrophages. B. Composed of fused macrophages, that is, giant cells. C. Composed of epithelioid cells. D. A mixture of chronic inflammatory cells. E. Composed of neutrophils, cellular debris, and fibrin. Well, those are the answers except E, which is not an acceptable characteristic of a granuloma. Dysplasia is characterized by the following features. A. Evidence of increased growth. B. Absence of cellular atypia. C. Loss of cellular polarity. D. Increase the number of mitotic figures. E. A low nuclear cytoplasmic ratio. The answer? So, C and D are true. Loss of cellular polarity, increased number of mitotic figures. These are characteristic features that we see in dysplasia. Which of the following are features of a granulation tissue? A. Contains fibroblast. B. Always contains granulomas. C. Often occurs after acute short-lived injury to liver. D. Contains thin-walled capillaries. E. Actively contract. Well, those are the answers except B and C. Liquefaction associated with necrosis occurs after infarction of A. Heart, B. Kidney, C. Brain, D. Liver, E. Spleen. Well, the answer is C. Liquefaction linked with necrosis occurs after the infarction that takes place in the brain. Which one of these apply to the benign tumors? Invasiveness. D. Easy to excise. E. Absence of cytonuclear anomalies. Well, the answers are D and E. A benign tumor can be easily excised and there is absence of cytonuclear anomalies. Which of the following can delay the incomplete resolution of acute inflammation? A. Abundant exudate. B. Necrotic material. C. Dilated lymphatics. D. Microcirculation, and E. Plasma cells. Well, the answers are A and B. Abundant exudate, necrotic materials, these can actually delay the incomplete resolution of acute inflammation. True or false question. A. Catecholamines increase the blood flow in the vessels. Is it true or false? B. Catecholamines are secreted by adrenal glands. True or false? C. Anuria. Failure of the kidneys to produce urine in shock is due to distraction of glomeruli. True or false? D. Venous blood return to the heart is high in case of early shock. True or false? E. Septic shock is due to microbial toxins. True or false? Well, the answers are here. So B is true and E is also true. Again, true or false question. A. Shock with the blood pooling is seen in spinal injuries. True or false? B. Catecholamines cause accumulation of blood in microcirculation. True or false? C. Anaphylactic shock is caused by AG-AC conflict in the presence of toxins. True or false? D. Ulceration of the mucosa can be seen in shock. True or false? Pulmonary embolism affects the venous return. True or false? Well, A is true, D is true, and E is also true. What happens in the site of acute inflammatory reaction? Well, A, neutrophils increase in number. B, lymphocytes are few. C, bradykinin dilate the vessels. D, there is migration of the red cells. E, the interstitial space fluids increase. Well, those are the answers except B. There are not few lymphocytes. What happens in shock? A, the pulse is fast. B, the pulse is difficult to feel. C, the skin is cold. D, the sweat reduce. E, the digestive tract secretion increase. Well, the answers are there except D and E. The sweat doesn't reduce. The digestive tract secretion does not increase. Which are true about atrial septal defect? A, occurs most frequently in females than males. Is the commonest heart anomaly or disease. Is associated with Down syndrome, also known as trisomy 21. D, may lead to pulmonary hypertension. E, can cause death before puberty if untreated. Well, the answer concerning ASD, so we are A is true, C true, and E is also true. True or false about arteriosclerosis? A, causes thinning of blood vessel walls. B, only affects elastic arteries. C, may be complicated by thrombosis. D, all of the above. E, none of the above. Well, arteriosis may be complicated by thrombosis. Cellular constituent of an atheromatous plaque include A, smooth muscle. B, neutrophils. C, foam cells. D, cholesterol. E, calcium. Well, all these are the cellular constituent of an atheromatous plaque. Complication of atheromatous plaque include A, thrombosis. B, hemorrhage. C, rupture. D, DIC. E, calcification. All these, thrombosis, hemorrhage, rupture, calcification, are complications except DIC. What is hemangioma? A, a malignant tumor of blood vessels. B, benign tumor of blood vessels. C, benign tumor of lymphatic vessels. All the above, none of the above. Well, hemangioma is a benign tumor of blood vessels. Which of the following is not a complication of aortic aneurysm? A, neurothrombosis. B, rupture of the aorta. C, embolism. D, dry gangrene. E, none of the above. Yes, none of the above is not a complication of aortic aneurysm. So neurothrombosis, rupture of the aorta, embolism, dry gangrene are complications of aortic aneurysm. Which is true about Kaposi sarcoma? A, frequently occurs in HIV/AIDS patients. B, affects the skin only. C, affects adults only. D, is a tumor of lymphatic vessels. E, it is curable. Well, the answer, it is frequently occurs in HIV/AIDS patients. It affects the skin, not only the skin, but other tissues as well. It affects adults as well as children, and it is not curable. What are the causes of transmural myocardial infarction? A. Coronary artery vasospasm. B. Coronary artery embolism. C. Coronary artery plaque thrombosis. D. Coronary artery vasodilation. E. None of the above. Well, the answers are coronary artery vasospasms, embolism, and coronary artery plaque thrombosis. Complications of myocardial infarction include arrhythmias, aortic aneurysm, cardiac failure, pericarditis, mitral regurgitation. Except B. Aortic aneurysm, arrhythmias, cardiac failure, pericarditis, mitral regurgitations, all these are complications of MI. The following are the causes of sudden cardiac death, except A. Aortic valve stenosis, B. Aortic valve prolapse, C. Cardiomyopathy, D. Myocarditis, E. Pulmonary hypertension. Well, except aortic valve prolapse. What organism causes rheumatic fever? A. Haemophilus influenza, B. Enterococci, C. Staphylococci, D. Streptococci, E. All the above. Well, the answer is Streptococci. Major manifestation of rheumatic fever include A. Skin nodules, B. Carditis, C. Erythema marginatum, D. Polyarthritis, E. Anasarca. Except anasarca, skin nodules, carditis, erythema marginatum, and polyarthritis are major manifestation of rheumatic fever. Infective endocarditis may be complicated by A. Suppurative pericarditis, B. Valvular insufficiency, C. Valvular stenosis, D. Multi-organ abscess, E. Glomerulonephritis. Well, except C, all the others are true. What type of blood cells are affected by multiple myeloma, a type of cancerous tumor? Well, neutrophils, eosinophils, lymphocytes, macrophages, and plasma cells. Well, the answer is actually E, which is plasma cells, which is the true